The mission of South Dakota Urban Indian Health goes beyond meeting the physical medical needs of patients.
As a nonprofit corporation funded through Indian Health Services, their goal is a more holistic form of care. In
tonight's Eye on Kettleland, Lauren Solik introduces you to the new leader at the organization, hoping to expand that mission.
Michaela Sieber has big plans for South Dakota Urban Indian Health.
I think we will grow and we'll be able to move locations closer to downtown where a lot of our patients are. And I would love to see us in a bigger building and providing more services like dentistry, physical therapy, having a pharmacy on site, having a bigger cultural space for people to come and gather and pray and get together with each other. I think that's really something that can happen in the near future.
Sieber took on the role of CEO for the nonprofit healthcare organization in February. She first started working at SD Urban Indian Health in September of 2020 as a grant project manager.
In November, our previous CEO passed away suddenly, and I just knew that was a space I wanted to fill. So I threw my name in the hat to the board to consider, and it's been a long couple months of interviews and talking with the board and talking about my goals.
Growing up in Sisseton and being a member of the Sisseton-Wahpeton Oyate, Sieber says it means a lot for her to be able to provide health care for Native people.
So much was taken from our relatives, and they were promised health care, in exchange for their land and so many other things. And we haven't really seen a great healthcare system set up for our relatives, especially in urban areas. So it's just astounding to me to think decades ago, my ancestors, going through that, and now here I am, really getting to take charge and provide care to some of my relatives. It's just like we're indigenizing this space in such a cool way.
Her first goal as CEO was to set up a cultural health department, which she has already done.
That was my main goal to get started off the bat, to just show we prioritize culture here, and we need to get back to that. Culture is medicine, and I think that the Western ways of treating people, they're good for some people, but we need to also make sure we're incorporating culture.
Teresa Henry is the director for the Cultural Health Department, or the Zania Oyate.
And that means that we're going to have practices or rules that we follow to help the people heal holistically in the community.
Henry has worked with SD Urban Indian Health for 3 years. She says this program is an expansion of previous services they offered, but it's an expansion they've been hoping for.
We've been praying and doing our best to work towards more holistic health care, especially cultural-based services for the Native people here in the community. And so I feel that one of our prayers have been answered with Michaela coming to the program.
Sieber also wants to expand who the organization works with.
So that's a big goal of mine, is to make sure we're thinking about culture and also providing that to other health systems in the area so that they can begin to refer patients to us, Native patients, and we can provide the cultural needs. Even if they don't come here for medical needs, they can come here and get some cultural needs met.
But South Dakota Urban Indian Health isn't just for Native Americans.
Although we have Indian in our name, and that's our primary focus, we are welcoming of all folks, regardless of their race, and I really think I want people to know that more and understand that we will be working harder to make sure we're serving all of our relatives, not just our Native relatives, although a lot of our programming will be focused toward them. I think everyone will benefit from having a holistic, inclusive healthcare facility here in Sioux Falls.
This is a beginning.
With Eye on Kettleland, I'm Lauren Solik.
South Dakota Urban Indian Health has clinics in Sioux Falls and Pierre. You can learn more about the organization by following the link under this story on kettleland.com.